If you have ever wondered what life looks like after your gallbladder is removed, you are not alone. Most people imagine recovery as a long, dramatic hospital saga. But in reality, it's usually more like a short, well-directed episode. A few hours in the hospital, a few days of soreness, and then a steady return to normal life. But every story has its twists. Some recoveries are smooth, some take detours, and some need a little more patience. Recovery is not a race, it's a series of small steps taken at the right time. And in surgery, the secret of getting better is understanding what recovery should look like and when to be cautious. Hi, I'm Gaurav and you're watching Gut Instincts. Today, we are breaking down the entire journey after laparoscopic or robotic assisted gallbladder removal for gallstones in a way that's simple, clear, and easy to understand. Think of this as your recovery roadmap, with a few witty signboards along the way. We won't go over the events that brought us here. In our video, Gallbladder Surgery, Why Timing is Everything, we already went over how to plan and time the surgery. Check that out to get the backstory. You can see exactly what happens during the surgery in our video, what surgery is done for gallbladder stones. I recommend watching that as well. Now let's dive into today's topic. After an uncomplicated elective laparoscopic cholecystectomy, most people wake up in the recovery room feeling a little bit groggy, like waking from a nap you didn't plan. Within a few hours, you can start sipping clear liquids. If that goes well, you slowly move to light food the same day. No dramatic liquid only for days diet, just a gentle progression. Because the cuts are tiny and pain is usually moderate, many healthy patients can go home the same day, especially if the surgery was done in the morning. High quality studies show no major difference in complications or readmissions between same day discharge and overnight stay. But context matters. In India, most patients stay overnight, partly because families feel safer and partly because traditional insurance prefers a 24-hour stay. Same day discharge is becoming popular in big cities, especially for patients who stay nearby. But surgeons often still prefer keeping patients overnight to ensure they can walk, eat, and manage pain before heading home. As the saying goes, one extra night in the hospital is a small price for peace of mind. Most patients feel a combination of pain: incisional soreness around the keyholes, a deeper ache inside the abdomen for 2 to 3 days. This usually responds well to simple painkillers like paracetamol and anti-inflammatory medicines. But then there's the famous shoulder pain, the brain glitch movement. This happens because the carbon dioxide gas used during keyhole surgery irritates the diaphragm. The diaphragm's nerves send a distress signal and your brain misinterprets it as shoulder pain. It's similar to a blurring of your body's electrical map. These aches diminish considerably within a span of days to a week. It's like going back to the gym after a long break. The workout is over, but the muscles feel stiff and achy for a couple of days. The discomfort fades steadily, and you know it's just your body settling back to balance. Similarly, the pain after surgery should get a bit better each day. But pain that suddenly worsens after initial improving, especially around days 3 to 6, can be a warning sign of a complication. If common painkillers don't work or the pain returns, it's a sign to seek further attention, not to wait and watch. You should probably inform your doctor. With a smooth keyhole procedure, activity restrictions are surprisingly few. Light activities are allowed from day one. Walking is encouraged. Climbing stairs is fine. Gentle stretching is okay. It's generally okay to take a bath beginning the day after the operation, and especially so for simple operations, provided that waterproof dressings are used to protect the wounds. However, the recommendations may vary depending on various personal preferences, and that's absolutely okay. Driving is usually possible within a week, though in Indian city traffic you might want to give yourself an extra week unless you enjoy sudden braking as a sport. Returning to work depends on your job. A desk job can be resumed within 1 to 2 weeks. Work from home may be earlier, but a job needing heavy manual labor might take a bit longer to start comfortably, maybe a month. Most guidelines now follow the rule: if it doesn't hurt, you can do it. This is a big shift from the old 2 to 3 month restriction era. Follow-up is usually scheduled 1 to 2 weeks after surgery to check wounds, review symptoms, and discuss pathology results. Regular long-term follow-up is usually unnecessary in uncomplicated situations, but it's important to keep up with regular health checkups to stay healthy and to catch any big health problems early. Coming to the diet aspect. There is no single gallbladder-free diet. Your digestive system just needs some time to adjust to bile flowing continuously instead of being stored and released in bursts. In the first few days, it is advisable to eat small, frequent meals with not too much fat. Avoid heavy, greasy feasts. Therefore, rather than consuming 2 to 3 meals daily, you could opt for up to 5 or 6 smaller portions throughout the day for a duration of 7 to 10 days. Every meal needs a healthy combination of carbohydrates, fats, proteins, and fiber. Drinking plenty of fluids is also important. All this will help in a faster recovery. We will discuss this further in a separate video. Over a few weeks, most people return to a normal diet, and many actually tolerate foods better than before because the disease is no longer misbehaving. Don't worry if you haven't had a bowel movement for a day or two after this surgery. It's completely normal. It should go back to normal within 2 to 3 days following the surgery, which is completely acceptable. A minority develop post-cholecystectomy diarrhea, loose stools due to bile acids entering the colon more continuously, which draws more water into the stools. This usually improves with time and can be managed with bile acid binding medicines, antidiarrheal medicines, probiotics, dietary tweaks. If symptoms persist or include pain, blood, fever, or weight loss, further evaluation is needed to rule out other gut conditions. Sometimes the keyhole operations need to be converted to an open surgery. This is not a failure, it's a safety decision, like taking a detour when the main road becomes too foggy to drive confidently. Recovery after open surgery is more traditional. A few extra days in hospital, a little stronger pain, possible use of epidural or tab blocks for good pain relief. Early walking is still encouraged. Heavy lifting is avoided for 4 to 6 weeks. If the gallbladder was removed during a severe infection or with complications like bile duct injury, recovery may stretch over weeks. These patients may need drains, antibiotics, endoscopic procedures, or further surgery. A quote commonly attributed to Lao Tzu, the ancient Chinese philosopher, perfectly suits here. Nature does not hurry, yet everything is accomplished. In difficult situations, healing has its own clock and it never runs on fast forward. Most patients choose surgery to escape recurrent gallstone pain, and for many, life after recovery is noticeably better. Studies show faster early improvement with minimally invasive compared to open surgery. But not everyone becomes completely symptom-free. A minority continue to have abdominal pain or discomfort months later, a cluster of symptoms called post-cholecystectomy syndrome. Why does this happen? Some patients actually have retained stones in bile duct or small remnant gallbladder, bile duct strictures or narrowings, sphincter of Oddi dysfunction, acid peptic disease, irritable bowel syndrome. Others can have non-gut causes like heart, muscle, or bone-related issues. Now, gallstones are common. Abdominal pain is also common. Surgery helps many but not all. As the literature says, cholecystectomy surgery is very likely but not guaranteed to relieve pain. This is why a thorough assessment before surgery and honest counseling are essential. If you want to know the actual symptoms of gallstones, do check out our video, What are the symptoms of gallstones? Now let's discuss some red flags after going home. Seek immediate medical attention if you notice sudden worsening of abdominal pain after initial improvement, high fever or chills, yellowing of eyes or skin, persistent vomiting or severe bloating, redness, swelling, pus or foul smell from wounds, shortness of breath, chest pain, or calf swelling. These may indicate bile leaks, infections, or clots. A simple rule: it's always okay to check in with your doctor if something doesn't feel right. In the video, what are the risks with keyhole surgery for gallstones? We tried to cover all the potential hazards linked with this type of surgery. Give it a watch if you are interested. Most people live completely normal lives without a gallbladder. No special diets, no long-term restrictions, no limitations on work, travel or exercise. People with symptomatic gallstones gain the most from surgery, especially when their pain truly comes from the gallbladder disease. A smaller group, those with complications or persistent symptoms, may need ongoing follow-up or further treatment. Recovery is not just about getting back to where you were. It's about moving into a more stable phase of health with realistic expectations and awareness of red flags. As surgeons often remind each other, the best operation is not just the one that goes well in the theater, but the one the patient recovers from well at home. Gallbladder stone surgery is one of the most common operations worldwide and one of the most successful. But success isn't just measured in stitches and scans. It's measured in comfort, confidence, and clarity. Recovery is a journey, sometimes smooth, sometimes zigzagging, but almost always forward. As the ancient Roman philosopher Seneca said, luck is what happens when preparation meets opportunity. And in recovery, preparation is understanding your body, your symptoms, and your red flags. If you are watching this because you or someone you love is heading into surgery, remember, you are not just removing an organ, you are removing a problem and making space for a healthier, steadier life. Do share this video with someone who is planning to undergo this procedure. Thank you for watching Gut Instincts. Bye.